we have the difficulty that already on several surveys and talking with colleagues who are African American who work in African American communities, that the skepticism, the reluctance on the part of particularly the African American community, but also other ethnically defined communities, the skepticism is very high and very strong. So we're going to have to do everything we can to reach out to them, provide information, but more important, it's the attitude. We're going to have to provide reassurance, and people who look like them, not me, are going to have to do that very important role. Perhaps we can work through, as is often the case, churches or people who are prominent African American leaders to reach out to this community. And Mark Twain told us the way you bring a reluctant man down from the second story, one step at a time. Mm-hmm. So we're going to have to do this in a sustained, diplomatic, gentle way. And what I hope is that the politicians now will step back, now that the election is over, and they put the public health people in front, and the doctors, and the scientific community, because I think that will help restore trust, frankly. There's still a political veneer over this vaccine, and I would like to remove that, because the more we can base it on science and public health, I think the more successful we will be. I think perhaps going forward, we will have a more nationally coordinated approach. You know, at the moment, the approach has been subcontracted to the governors, and we have kind of a crazy quilt of approaches out there, some of which clearly are not working at all. California is really among the best. I'm impressed. But if I could wake up in the morning and have every person in the country walk out their front door wearing a mask, that would make my heart sing. Schools are a real problem. First of all, they're close to the heart of all the parents, right? Fortunately, the children, as we all know, are they're not immune, but they're less affected than adults. I think there's general agreement that the degree of control in the community has a huge impact on the relative safety of opening up schools. Also, schools with more resources, the facilities to actually implement a variety of containment measures, social distancing, and a whole series of things we could talk about, are obviously in a better shape than schools who limit those resources. We all want children to go back to school for, and again, a whole list of reasons. I think school closings should be the result of data, just as Dr. Nguyen says. If you have a big outbreak in a school for one reason or another, you'll probably want to go back to virtual learning for a period of time and revisit what you didn't do well enough to start. And so at the moment, we have school policies that are even more varied than the policies in all the 50 states across the country. Private schools, public schools, inner city schools, rural schools. There are a lot of different approaches, some of them in my own state colored by the local politics, as a matter of fact. And I don't think that there is one good answer. In general, I would say, see if Dr. Nguyen agrees with me, the school openings that have occurred, no matter how heterogeneous they are, have been on the whole, I think, a little safer. It's gone a little better than we had feared.